Welcome back, good people, to my YouTube channel. I'm Mongia Clinician. This is a channel where we discuss matters health. So don't forget to subscribe, to like, and to share my video. So today's topic is a continuation of what we had looked at in the previous video. And we had looked at what is hypertension, classification of hypertension, and the risk factors to acquiring hypertension. So for today, we shall be looking at the signs and the symptoms of hypertension. So we'll be back, guys. Before I go to the signs and the symptoms, I would like to address a query that had been raised from the previous video, and that was how high is blood pressure in terms of figures. So according to the national guidelines, any reading that is above 140 for the upper reading, also referred to as the systolic, and any reading above 90 for the lower reading, also referred to as the diastolic, would be considered to be high. So any reading above 140 over 90 for a sustained duration of time would be considered to be high. Today I shall be doing things a bit differently because we'll be teaching using a manila. So let's go direct to the signs and the symptoms of hypertension. Say that many a times hypertension does not present with any signs or any symptoms until one gets into complications. But we find that, however, we find that there are individuals who normally experience certain signs and symptoms, and this is what we are going to look at today. So one of the signs and the symptoms is headache. Most individuals who are hypertensive normally experience headache, which is normally severe. We have dizziness. This is a feeling of drowsiness, or like someone is going to lose consciousness or faint. And then you have blurred vision, which is not being able to visualize or to see clearly. We have nose bleeding. Then you have chest pains. We have shortness of breath, or one feeling like they are running out of breath. Then you have easy fatigability, which is getting exhausted very fast, even when one has not performed any duty or any activity. We also have irregular heartbeats. We have pounding in the chest or in the neck. And this is whereby one is able to feel their own heartbeat, which is normally quite loud. So let's go to the management of high blood pressure. This is divided into two. One is non-pharmacological management. So for the non-pharmacological management, this is where we control blood pressure through modifying our diet and our lifestyle without having to use any medications. So when you look at the non-pharmacological management, we shall be looking at the risk factors that we had looked at in the previous video, specifically the modifiable risk factors, or the risk factors that we have control over, because there are those we say that we don't have control over. So one of them is physical inactivity. We are advised to exercise regularly, at least for 30 minutes in 5 days, and that's a total of 150 minutes for a whole week. And when you talk of exercising, we don't necessarily mean you have to go to the gym. Any physical activity that would lead to sweating is actually enough. For example, brisk walking, jogging, riding a bike. So something else is having a healthy weight or maintaining a healthy weight. And this is through having a healthy diet as well as exercising regularly. Then you look at maintaining healthy dietary measures. So under this, we shall be looking at a DASH diet. These are dietary approaches to stop hypertension. So the DASH diet mainly focuses on having a meal that is high in fruits and vegetables, because they are loaded with lots of minerals, and these minerals normally help to regulate blood pressure. And then it also focuses on a diet that is low in sodium or salt, especially the salt that we normally add to already cooked food. It also focuses on having a meal that is low in saturated fats, which are normally common in deep fried foods, fatty meats. And then The DASH diet also encourages having a meal that is rich in whole grain cereals, for example, millet, sorghum, whole grain, wheat flour. So for the females who are using the estrogen-based method of contraception, they are encouraged to talk to the healthcare provider so that you're able to see what other method would work best for you without having to interfere with the blood pressure. And then you have a frequent blood pressure monitoring, and it is in this monitoring of blood pressure that you'll be able to know if your blood pressure is controlled or not. So if in case it's not controlled, your healthcare provider will be able to see the advice to give you, maybe matters diet or change the medication. Then you have stress management, and stress is actually one of the major causes of most health issues that you're normally facing. Unfortunately, it may not be able to avoid stress. However, it's possible to manage it, maybe through the help of a life coach, psychologist or counselor, religious person. You can try to figure out what would work best for you, so that you are able to manage whatever is bothering you, or to manage the stress that you're undergoing, so that you are able to keep your blood pressure on check, as well as avoid acquiring hypertension or being at risk of acquiring hypertension. Then something else is avoiding over-the-counter drugs, the NSAIDs, which are the non-steroidal anti-inflammatory drugs, which include brufen, diclofenac. So instead of just going and purchasing these drugs, you can seek the help of a healthcare provider, so that they will advise you accordingly. Another thing is reducing smoking and alcohol consumption, or stopping altogether, so that you're able to control your blood pressure or to keep it on check. Something else is we had talked about secondary hypertension, whereby we say this is as a result or it's secondary to something else. So if the cause of this hypertension, which could be thyroid disorders, liver diseases, kidney diseases, uncontrolled hypertension, uncontrolled diabetes, brain tumors. So if your healthcare provider or if the doctor is able to eliminate those issues or those health issues, then definitely your blood pressure will be controlled. So for the pharmacological management, this is whereby on top of observing lifestyle and dietary measures, your doctor will put you under medication. And for the healthcare provider to put one under medication, they normally consider other factors. For example, how high is the blood pressure by the time they are starting you on antihypertensives, and also if you're having other chronic illnesses, for example, diabetes, asthma, heart failure. Because for example, if you're suffering from asthma, there are certain antihypertensives that we refer to as beta blockers, which include propranolol, atenolol. These kind of medications are contraindicated, or rather they would have undesirable side effects. So the doctor will consider such issues before they start you or they put you on antihypertensives. Now, there are several classes of antihypertensives, around 6 classes, and they normally regulate blood pressure through maybe reducing the amount of fluid in the blood vessels, allowing relaxation of the heart, as well as relaxation of the blood vessels, or reducing contractility, reducing contraction of the blood vessels. So these antihypertensives may have side effects. So in case you experience any side effect, don't just stop taking the medication. Rather, you should visit the healthcare provider who started you on the antihypertensives, so that they are able to maybe change, or they are able to change for you the medication. Because the moment you stop the antihypertensives without having seen your healthcare provider, definitely your blood pressure will keep rising and you may get into complications. So there's something else that I wanted to mention, and it's the use of psychosocial, or the importance of something referred to as the psychosocial groups. These are groups whereby you find that individuals who have a similar illness, for example, individuals who are suffering from hypertension, normally come together to form a group, and they'll be meeting regularly in the presence of a healthcare provider or health worker. And in these meetings, they'll be able to share their experiences, the challenges they are facing taking antihypertensives, and they're also able to encourage each other so that one does not feel overwhelmed or discouraged. And these normally help to ensure that there is good adherence to antihypertensives. Thank you very much for watching my video. Don't forget to subscribe, to like, to share. If you have any query or if you have any input or any comment, don't forget to put it in the comment section, and ensure that you watch out for the next video whereby we shall be looking at the complications of hypertension. Thank you.